Good day, everyone. Welcome to Ready, Set, Go, a webinar series sponsored by HUD's Office of Special Needs Assistance Programs, known as SNAPS. My name is Mark Allison, and I work at the Center for Social Innovation, and I'll be moderating today's webinar. On behalf of SNAPS, I would like to thank all of you for joining us. Today's webinar is Reporting Housing Inventory Count and Point-in-Time Count Data in the Homelessness Data Exchange. We'll be featuring the following presenters: William Snow from the HUD SNAPS office, Tracy Dialano from Apt Associates, and Lauren Dunton, also from Apt Associates. Additionally, we have Tom Albanese on the line with us as our resource advisor to answer any content questions you may have. Next slide, please. Before we begin today's presentation, I would like to make some logistical announcements. Today's webinar will last approximately 90 minutes and is being recorded. I know the slide says 1 hour, and we're going to do our best to go through the material as efficiently as possible, but there's a lot of it. The webinar recording will be posted next week on the OneCPD Resource Exchange Trainings and Events page at the address on your screen. An email will be sent to all attendees following the presentation with instructions for how to get credit for this training, and also to request that you complete the feedback survey. Because of the large size of the audience, all attendees will remain on mute for the duration of the webcast. Next slide, please. You may submit questions in the questions box up on the right-hand side of your screen in the GoToWebinar navigation bar. Your questions are important to us. However, the resource advisor may not have time to answer all of the questions during the webinar. If we do not get to your question, please submit them to the OneCPD Ask a Questions page at the web address on your screen. And when you do so, please remember to reference this presentation in your question. We do recommend using your phone rather than your computer speakers to hear the audio for today's presentation. Also, as always, just a cautionary note, due to the large number of attendees, there may be a slight delay in the advancement of some of the slides. If you experience any other technical difficulties, please request assistance by using that same questions box in your toolbar. Next slide, please. The HIC and PIT data entry guidance document referenced during this webinar is available on the Training and Events page of the OneCPD Resource Exchange in the course catalog. And as I mentioned, the recorded webinar will be available at the same location within 1 week of the presentation. The Find By box can be used to filter the hundreds of different training materials that are available on that site. Next slide, please. So our learning objectives for today: upon completion of this webinar, participants will be able to understand data entry workflow processes for the HIC and PIT, accurately enter required HIC and PIT information by the final data entry deadline, and understand the new procedures for assigning access privileges in the HDX. Now I'd like to turn it over to William to begin today's presentation.
Thanks, Mark, and welcome to everyone on the webinar. As you all may know, due to HARTH implementation and tough budget discussions, tracking of the federal strategic plan goals, and other priorities, 2013 is a critical year for our counts. We at HUD are aware of your competing priorities and pressures, and we appreciate your hard work. I've had a chance to talk to several folks in several communities in the past couple weeks, and am continually impressed with the significant effort and sacrifice everyone makes in order to count and serve homeless persons. I want to assure you your work does not go unnoticed, nor is it fruitless. We use the data from the counting process, as we have in the past, to continue to make a compelling argument to Congress and others that you're making a difference in the nation and striving and deserve the funding to continue this great work. We have a packed agenda for today's webinar. We plan on covering the HDX registration and login process, an overview of how to enter and submit your housing inventory count data, an overview of how to enter and submit your point-in-time count data, and reminders of how the CoC can download HIC and PIT reports for use in your community planning processes. Well, today's webinar will give you an overview of the HIC and PIT data entry process. Please make sure to download the data submission guidance document from the resource page on the OneCPD Resource Exchange website, which provides step-by-step instructions. In addition, useful information can be found in the HIC and PIT data collection guidance document, also posted on the OneCPD Resource Exchange website. There are two things I want to highlight up front. First, some screens have red highlighted or red bolded comments. These comments address areas of confusion from the past. You need to pay close attention to those issues and ensure that you're complying with the requirements stated. Second, we've added some additional data collection methodology questions this year in the HDX process. With a heightened emphasis on data and performance, we feel it's critical that we have an understanding of and confidence in data quality. We're in the process of revisiting our counting methodologies guidance, so the more information you share with us about how you count, the better. Most critically, we're trying to balance data quality with the level of effort required at the local level. We recognize you have constrained resources and time, and we want to respect your limits. Next slide, please. All CoCs must submit HIC and PIT count data through HUD's Homelessness Data Exchange, the HDX, as it has in the past. CoCs are able to enter HIC and PIT data beginning Monday, April 1st, 2013, or yesterday, and must submit final data by Tuesday, April 30th, 2013. Submitting the HIC and PIT data in HDX is a two-part submission process. CoCs must submit both the data entered into the HIC module and separately submit the data entered into the PIT module by the submission deadline in order for your submission to be considered complete. Thank you again for your participation in the webinar. I'll turn the time over now to Tracy Dialano to discuss the HDX registration and login process.
Well, thank you, William. And welcome and good afternoon to everyone who's participating today. Please note that the HDX website has been enhanced to allow users easier access to creating and managing user accounts. In this section of the webinar, we will provide an overview of how to create user accounts and the process that Continuum of Care primaries should use to both add new users and assign rights to the modules within HDX. All right, next slide, please. And we should be on slide number 9. Note that the Continuum of Care primary contact is responsible for overseeing who has access to HDX and for assigning read, write, and submit authority to authorized users. So next slide, please. So if your CoC needs to update their primary contact, please follow these instructions in order to get your CoC primary contact updated in time for you to submit your data. Please see the guidance document for how to enter data for step-by-step instructions. Let's go ahead and move on to the next slide, please. So let's talk a little bit about how the Continuum of Care primary can add users to HDX. To add new users, the CoC primary should click on the HDX Admin tab. Note that this tab is only visible to the Continuum of Care primary contacts. Once on the Admin tab, the CoC primary contact should click on the Add User button. Next slide, please. Continuum of Care primary contacts will need to know the user's email address and first and last name in order to create the user accounts. Enter the user's email address and their first and last name, and then click on the Add User button. The HDX will display an alert if it is unable to find an account associated with that email address. CoC primary contacts should contact users who have not yet created an account and ask them to register at the HUD HDX Create an Account site. After creating an account, the user will be able to log in to the HDX. Next slide, please. So let's talk about how we assign rights in HDX. The Continuum of Care primary contact should assign one of 3 levels of access rights to each HDX module for each user by checking the box that corresponds the appropriate level of access. The levels of access in the HDX are read, which means that you can see the screens and any data that has been entered, but you cannot enter or edit data. Write means you can enter and edit data, but you cannot submit data. And submit, which means you have the authority to approve and submit data to HUD. Also note that there is a link on the right side last column of the page that the COC primary contact can use to remove users who should no longer have access to HDX. Please make sure that your current list of users is up to date and that individuals who should no longer have access to your Continuum of Care data in HDX have been removed. Okay, let's move to the next slide, please, and we should be on slide number 14. A user account with a username and password is required to access the HDX. All HDX users who need read, write, or submit privileges for the HDX must establish an account at the HUD hdx.info site. Note that this information is included in the 2013 HIC and PIT Data Submission Guidance document. Please download this document for step-by-step instructions. Okay, next slide, please. New this year is the ability to update your account information and password. Users who need to change their password, update their email address, and other contact information can do so from the HDX dashboard. Once logged in, navigate to the dashboard and click on the Update Your Account Information link. Again, download the HIC and PIT Data Submission Guidance for step-by-step instructions. Next slide, please. Okay, we should be on slide number 16. Note that this webinar will not cover data collection. It is focused on navigating the HDX and entering data. For information about data collection requirements, please download the HIC and PIT Data Collection Guidance document from the One CPG Resource Exchange website. Also note that slides with resource links will be shown at the end of the presentation. Okay, next slide, please. This particular slide shows an example of how HIC data is organized in HDX. Note that HIC data in HDX is made up of three basic components: organization records, program records, and program inventory records. Organization records can only have one characteristic, the organization name. Program records belong to an organization and have several characteristics, including the program name, the program type, geocode, and target populations. Just as a program can only have one name, it can have only one program type, one geocode, and so on. A program must have at least one program inventory record, and it may have several program inventory records. Program inventory records belong to a program and include a number of data points about program beds and units, including inventory type, household type, bed and unit inventory information, HMIS participating beds, as well as PIC count for the beds included in the program inventory record. Okay, next slide, please. The HIC module in the HDX is split up into tabs that are designed to help you enter organization, program, and program inventory data accurately. There are 6 tabs on the secondary navigation bar. To access any one of these tabs, simply click on its name in the gray navigation bar. Today we will provide you a brief overview of each of the 6 sections. Please note that more detailed instructions can be found in the 2013 HIC and PIT Data Submission Guidance document. So for example, the Organizations and Programs tab is used to enter information about organizations and programs. The Inventory List section of HDX allows the user to see all the housing inventory and the data associated with that inventory in a spreadsheet format. The Inventory Details tab is the tab where you will enter specific bed and inventory information about each program. Please remember that you must complete the Unmet Need tab before you will be able to submit your HIC data. The Reporting Status tab is where you will go to submit your HIC data, access report summaries, and see and link to various validation errors and warnings. Finally, the Import Data tab allows you to either upload your HIC data from your HMIS or to copy your previous year's HIC data. Next slide, please. Rather than entering all of your HIC data, you can duplicate your Continuum of Care's 2012 HIC data as a starting point. There are two ways to do this. When you log into the system, it will automatically take you to the dashboard. If you click on Copy Data from the 2012 link in the HIC box of the dashboard, it will automatically take you to the Import Data tab. Or, of course, you can navigate to the Import Data tab. Once you've clicked the Copy Data from the dashboard, the feature will disappear. After clicking one of the Copy Data buttons, all organizations and programs are replicated from 2012 and uploaded as 2013 inventory. You can then edit or delete these individually, or you can add entirely new organizations and programs. Please make sure to enter the date that your Continuum of Care conducted their housing inventory count prior to clicking on the Copy Previous Year button. If your HMIS software has this capability, you may also upload HIC data from your HMIS, and we will review that on the next slide. So let's go ahead and move to the next slide, please. And we should be on slide number 20. You may choose to upload HIC data in CSV format that has been generated by your HMIS application, if your HMIS offers that functionality. To import CSV data, navigate to the Import Data tab on the gray toolbar and click on the Upload CSV Files link. Please refer to the HIC and PIN Data Submission Guidance document for specific step-by-step instructions on how to upload your HIC data from HMIS into HDX. Okay, next slide, please. Next, we're going to talk about the HIC Inventory List page. The Inventory List provides a complete listing of your Continuum of Care's inventory. Make sure that you click on the Set Date link to enter the date of the housing inventory count if you haven't already entered it from the Import Data tab. The Inventory List also allows you to search and filter your inventory list to help you find organizations and programs faster. You can search and filter your inventory list based on an organization or program name, the inventory year, or a specific program type. You can also sort columns to organize the list better. Note that when you export your data from the inventory list into an Excel document, it will be in a CSV format. However, just save the document as an Excel document, and you will be able to come back to it as an Excel document in your computer. Next page, please. The Organizations and Programs tab is similar to the HIC inventory list and is the starting point for managing organizations and programs. Note that there are two radio buttons, Organization View and Program View. If you want to see both the organization and the program, make sure to click on the Program View radio button. To add a program, click on the blue Add an Organization or Program button. To edit an organization, just click on the name of the organization. To edit a program, click on the program name. You can add a new program to an existing organization or create a new organization at the same time you create the program. Next slide, please. So we're going to talk a little bit about adding new organizations and programs. Again, to add a new organization or program, click on the Organization and Programs link on the secondary gray navigation bar within the HIC module. Once on the Organization and Programs page, click on the blue Add Organization and Program button, and the system will take you to another screen where you can enter your organization and program information. Next slide, please. And we should be on slide number 24. After you've added a new organization and program from the Organizations and Programs tab, you will need to visit the Inventory Details tab to enter the bed and unit information about the program. Next slide, please. New this year is the ability to enter optional program address information, including the street, city, state, and zip code. Note that the address is specific to the program, which may be different than the administrative offices of the organization. Also note, do not enter address information for domestic violence programs. The system will also run an address validation check to standardize the format provided by the United States Postal Service. Next slide, please. So, to edit an existing organization, follow these guidelines. To change the name of the organization, click on the organization name on the Organizations and Programs tab. This will bring up a new screen. Update and save the organization's name. Note that the update will apply to all the programs shared by that organization. Next slide, please. If you need to edit any of the basic characteristics of a program, again go to the Organizations and Programs tab in Program View and click on the program's name. Clicking on the program name will bring up the Edit page. Next slide, please. On the Edit Program page, you will be able to edit the organization name, the program name, the status, which means allowing to see if the program is active. The program closed, you will be able to close the program for 2013. If the program closed and you do not want it to appear on this year's HIC, selecting Close will indicate that the program is no longer operating and available for occupancy. However, if for some reason the program reopens in another year, you will be able to change the status back to active. Also note, if you change the organization name on this page as you are editing a program record, you will change the name only of that organization for that program. This is useful if the administration of a program is transferred from one organization to another. However, please note that if an organization has multiple programs and you need to change the organization name for all the programs, you will need to follow the instructions under Editing and Organization. All right, next slide, please. And we should be on slide number 29. Adding and updating program inventory information is completed through the Inventory Details page. There are two ways to access the Inventory Details page. To access a specific program directly, navigate to the Inventory List page using the gray secondary navigation bar in the HIC module and click on the program name. When you do this, the system will take you directly to the program inventory details for that specific program. Next slide, please. You may also navigate directly to the Inventory Details tab by selecting the link for this tab from the gray secondary navigation bar in the HIC module. From the drop-down arrows, select the organization and the program for which you need to add or edit inventory data. If the program does not have any inventory detail records, a blank inventory form will be displayed on the right-hand side of the page. Next slide, please. Use the Inventory Details tab to record bed and unit information that belongs to a program. It includes a number of different data points about the program beds and units, including the inventory type, the bed type, whether or not the beds are for households with children, households without children, or households with only children, the bed and unit inventory count information, and the number of HMIS participating beds. Note that which fields are required for an inventory details record depends upon the provider program type. In this example, the provider program type is emergency shelter, so specifying a bed type is required. In addition, Continuums of Care can record information about any seasonal or overflow beds. All right, next slide, please. To edit program inventory, choose the organization and program you wish to edit. If the program has more than one inventory row, click on the row that you wish to edit. So in this example, on this slide, you can see that there are 3 inventory rows, and highlighted is the bottom row. When you click on that orange bottom row, you'll bring up the inventory records for that particular inventory. Next slide, please. So adding new inventory to a new program. You can also add a new program or add inventory to an existing program from the inventory details page. To do this, click on the Add New Program link to create a new program. Click on the Add Inventory button if you just need to add new beds to an existing program or beds under development to an existing program. All right, next slide, please. And that should bring us to slide number 34. So now we're going to just highlight a couple of new things that are available underneath the program inventory for this year. So note that Rapid Rehousing Provider Program Type has been added as a new provider program type. Please make sure that you review the data collection guidance document for more information about how to best categorize rapid rehousing projects. Also note that Rapid Rehousing for the Homeless Families Demonstration Projects that were funded in 2008 CoC competition should still be identified as a transitional housing provider program type using a rapid rehousing model. All right, let's go ahead and move to the next slide. The other thing that's new this year is that the Homeless Prevention and Rapid Rehousing Program has ended, and therefore HPRP has been deleted as a program type. These programs will be automatically closed when you copy your 2012 HIC data. Continuums of Care that were able to maintain these programs through other funding will need to reopen them in HDX and categorize them underneath the appropriate program type. Please see the 2013 HIC and PIT data entry guidance for specific instructions on how to reactivate closed programs. All right, next slide, please. Lastly, provider programs with inventory identified as under development will need to indicate this year whether or not the provider program is expected to begin operation within the next 12 months. And that's sort of the last of the new things for the HIC this year. Let's go ahead and move to the next slide, which brings us to slide number 37. So let's talk a little bit about entering a PIT count on the HIC. In order to determine program bed utilization rates, every program on the HIC will need to include a count of the number of people utilizing the beds on the night of the Continuums HIC and PIT count. Prior to entering a program PIT count, the PIT count date needs to be set in the PIT module. If the PIT count date has not yet been set, you or someone with right access to the PIT module will have to set it. To do this, click the Set Date link in the dark blue box on the bottom right of the inventory details page. The Set Date link will take you to the PIT Counts module, where you can enter the date of your PIT count and save. The system will then take you back to the inventory details page that you were on in the HIC module, where you can finish entering your data and saving the record. Please note that the total number of sheltered persons counted on the HIC should equal the total number of sheltered persons counted on the PIT. Any discrepancies between the number of sheltered persons counted on the HIC and the number of sheltered persons counted on the PIT in the PIT module will result in a validation warning requiring you to enter a note of explanation in the PIT module of HDX. Okay, next slide, please. Please note that all continuums of care are required to complete and submit estimated unmet need data for their CoC. CoCs can access the Unmet Need tab by clicking on the Unmet Need tab on the gray toolbar. Note that every cell on the Unmet Need tab requires that a value be entered. If the value is 0, enter 0. For further guidance on calculating unmet need, please review the Calculating Unmet Need for Homeless Individuals and Families guidance document. You will be able to find this document on the OneCPD resource page, and information and links will be shown at the end of the presentation. Please note, we've had problems in the past, so this tab must be completed before you will be able to submit your HIC data. All right, next slide, please. We're going to talk just a little bit about validation warnings and errors. HDX will display validation warnings and errors to assist you in identifying and addressing any inconsistencies in your HIC data. Validation errors and warnings will be shown on the inventory details page and can also be viewed on the reporting status page. Validation errors must be corrected before the HDX will permit you to submit your data. Any form that has a validation warning should also include a note of explanation in its notes box. All right, next slide, please. So lastly, let's talk quickly about submitting data. If your HIC data is error-free, the Submit Data button on the Submit Data page will be blue. Click it to submit your HIC data to HUD. If you cannot see the blue Submit Data button and your HIC is error-free, then your Continuum of Care primary contact has not provided you with Submit Data rights. You will either need to ask your CoC primary to provide you with Submit rights and ask them to review or submit your data. Please note that submitting the HIC and the PIT in data in HDX is a two-part submission process. You will need to go to the Submit Data page in the HIC to submit your HIC. You will need to go to the Submit Data page in the PIT to submit your PIT. Don't assume that if you've clicked and submitted your HIC that your PIT data has also been submitted. And that is all we have for the housing inventory count information. And now I'm going to turn it over to Lauren Dutton to talk about entering and submitting your PIT data. Next slide, please.
Great. Thanks, Tracy. So I'm going to spend a few minutes and talk about entering and submitting point-in-time count data into the HDX. Next slide, please. So to begin entering your point-in-time data into the HDX, you need to navigate to the PIT module in HDX. So the second arrow on the slide, the one on the right, is above the PIT module. So you click on that link, and then once you're within the PIT module, you should be automatically directed to the PIT Counts tab, which is the arrow on the left. To begin entering your 2013 count information, you will need to click on the blue New Count button that's outlined in a red box on your screen, and that will open up the data entry form. Next slide, please. So entering your 2013 point-in-time count details begins with entering the date of your point-in-time count. So if the CoCs are required to conduct their counts during the last 10 days in January, If you conducted your count outside that 10-day period, you need to indicate whether or not you received a waiver from HUD to conduct your count outside that period. You'll notice that the next to, on the right of the date entry point, there's a question about what population count you did this year. Because 2013 was a required year for sheltered and unsheltered counts, that radio button is automatically filled in for you, and the radio button for sheltered only count is disabled. Next slide, please. So first you're going to enter the population data for your point-in-time count. So you're going to enter the number of persons by household type, program type, and age category that you count in the COC. So the first category on the top would be persons in households with at least one adult and one child. You need to report the total number of households for both emergency, transitional housing, and unsheltered that fall in that category, as well as the number of persons in each of the 3 age categories. The age categories are new for this year, so that's persons under age 18, the number of persons ages 18 to 24, and the number of persons over age 24. For persons in households with only children, you're going to be reporting the number of one-child households, the number of multi-child households, and then the total number of persons is calculated for you, and you'll notice that's a gray box. And then you also need to report the number of children in multi-child households. For persons in households without children, you need to report the total number of households, again for emergency, transitional, and safe haven programs, as well as unsheltered persons. And then the 2 age categories you need to report for in this household type are persons between the ages of 18 and 24, and persons over age 24. Next slide, please. The second tab in the point-in-time count module is for homeless subpopulations. The tab is outlined in red at the top of the screen. On this tab, you're going to be filling out information on the number of persons in each of the subpopulations. So the first subpopulation will be looking at chronically homeless persons. You need to report on the number of chronically homeless individuals, the number of chronically homeless families, both the total number of persons in those families, and then the total number, the total number of families, and then the total number of persons in those families. The other homeless subpopulations that you need to report on are the total number of veterans. This includes male and female veterans. Specifically, the number of female veterans, that would be a subset of all veterans. The number of persons that were severely mentally ill, the number of persons with chronic substance abuse issues, the number of persons with HIV or AIDS, and then this year it's optional whether or not to report on the number of victims of domestic violence. For those populations, you're going to be reporting on sheltered and unsheltered persons. It's important to point out here you should only be including adults in the subpopulation counts, except for the total number of persons in chronically homeless families. Once you've entered this information, make sure that you're clicking the blue Save button. It's at the top and bottom right side of the screen. Next slide, please. So something new for 2013 is that HUD's going to be asking some questions about the methodology that you use to conduct your sheltered and unsheltered counts. So there's a new methodology tab that's been built into the point-in-time module. It's the 3rd tab over. And then within that, the methodology section, there are 5 tabs that you're going to be answering. So this slide covers the first 2, the tabs on sheltered population and sheltered subpopulation. The questions are going to ask about the data sources that you use to conduct your count, the participating providers in your count, whether or not you used extrapolation in your count, the process that you use to deduplicate your data, and any steps that you took to ensure whether or not that you had an accurate shelter count. For step-by-step instructions of how to and what's included in each of these questions, please reference the data submission guidance that has been posted on OneCPD. The link will be displayed at the end of the presentation. Next slide, please. So the methodology questions related to the unsheltered populations and subpopulations accounts are very similar. Again, they're going to cover topics about the data sources that you use for the count, the participating providers in the count, whether or not you used extrapolation, the process used to duplicate the unsheltered data, and then the steps you took to ensure that you had accurate unsheltered point-in-time count data. So again, those questions are highlighted in the guidance in great detail, so I would encourage you to look closely at the data submission guidance. Next slide, please. The last component of the methodology questions is about a comparison of the 2012 and 2013 data. So you should look at your 2012 data. You can go back and look at that in the HDX. If you navigate back to the primary point-in-time count screen, you can see all the different counts listed there. So you can click on your 2012 count data and look at the totals that you had for sheltered and unsheltered, and then navigate back to the 2013 count to finish answering these questions. But you're asked to compare the 2012 and 2013 data, indicate whether the number of persons in the shelter count and the unsheltered count increased, decreased, or did not change between the 2 years, and then you need to explain why you think these changes occurred, any specific factors that may have resulted in this increase, decrease, or no change. When you're finished entering all of the different methodology tabs, just make sure you're hitting save every time so that the data is captured in the HDX. Next slide, please. So the last of the 4 tabs in the point-in-time module is the Notes tab. This you've had in the HDX for the past several years, so you may be familiar with it. This is the point where you need to enter any explanations for any error warnings that may have been generated in any of the other tabs. Also, any information that you think it would be helpful for HUD to have to better understand the data you're presenting for your count, any factors that may have influenced the data on that day, if there are any weather situations or any events that are going on in the COC that may have impacted the count, either resulting in a higher than average or a lower than average count. That's really great information to enter into this Notes tab. More information is always better. If you're hesitant on whether or not you should be including it, I would encourage you to include it in this tab. Make sure you click Save. It's on the bottom right before navigating to the next screen. Next slide, please. Okay, so submitting the point-in-time count. As Tracy and William emphasized before, you need to submit the point-in-time count separately from the HIC count. So on the Reporting Status tab, you should go through and review and address all validation errors and warnings. Remember that validation errors must be addressed to be able to submit your data, and any warnings must be explained in the Note tabs, as I just mentioned. So once you've reviewed all of the error warnings and you feel like you've addressed everything to your best of your ability, you should make sure to click on the Submit button that is in the upper right corner. It's highlighted in red on your screen. Next slide, please. Okay, so again, you can see this is a common theme throughout the presentation. We've had this problem a lot in past years, so we just want to make sure that you check before the last day, before April 30th. Make sure that you know who the person in the COC is with submit rights. Make sure that that is the correct person for the COC, and that person is aware of their responsibilities to submit both the HIC and the PIT modules. Know that they need to emphasize that they need to submit both the HIC and the PIT. If the person is going to be out of the office or there's some situation where they don't think they're going to be able to submit, make sure you transfer those submit rights to another person before the deadline, as HUD will not be granting any extensions for problems with submission privileges. Next slide, please. So just wanted to spend a couple minutes about next steps for using your point-in-time and housing inventory count data in your community. So the HDX can generate multiple HIC and PIT reports for communities and COCs to use for their own planning purposes. All of these reports we've built into the HDX, and they cover a variety of topics, and you can use this data to inform local COC decisions. All of these reports can be accessed from the Reports tab. You can see on the toolbar on the bottom of the screen. There are specific reports for the HIC, for the PIT, for AHAR, and for the COC profile reports. So we really want to remind you about these reports and encourage you to use them as you're engaging in planning processes in your COC and other local agencies. Next slide, please. Okay, so this is just wrapping up the presentation. We wanted to direct you to some other resources that may be helpful as you begin your data entry process into the HDX. The guide for counting sheltered homeless people is a great help for methodology issues around conducting the sheltered counts. It's not on here, but there's also a guide to counting unsheltered homeless people. The link is the same, except it's unsheltered instead of sheltered. Also a link to the 2013 HIC and PIT data collection guidance. As we mentioned at several points in the presentation, it may be helpful to go back and consult the data collection guidance if you're having questions about what data you need to be reporting and any definition questions. The third link is to the data submission guidance. That's what was covered in today's presentation. Again, the guide goes into a very step-by-step approach to completing the both the HIC and the PIT modules. So if there's points that you felt like maybe we didn't get into enough specifics, I would encourage you to go through and look very carefully at the guidance. And then lastly is the link to the Unmet Need guidance. So with that, I'm going to turn the presentation back over to Mark to wrap up.
Yeah, thanks, Lauren. Thanks very much. And also to Tracy and William for today's presentation. Also wanted to thank Tom again for answering the online questions. It looks like we are going to come in within the hour, so that's great. And thanks to everybody for joining us today for this webinar. As a reminder, if you have questions that we didn't get to today, please do submit them through the 1CPD Ask a Question page. And you're looking at a landing page right now for that. That's what it was designed for. It's staffed up, and we really encourage you to use it whenever you have questions. So please do that. And just some more reminders. One final reminder that the webinar recording will be available on the 1CPD Resource Exchange Training and Events page within a week, and the presentation's already there. Also, an email will be sent to all attendees right after this training with instructions for how to get credit for this training and also to complete that feedback survey. And please do complete that. We do look at those and incorporate your suggestions into future presentations. Next slide, please. So more ways to get assistance. You can obtain information or assistance from the 1CPD Resource Exchange by searching the resource library, checking out the 1CPD news, using the Ask a Question function I just talked about, or requesting technical assistance. So please join us Tuesday, April 16th for a webinar on unified funding agencies at 3:30 p.m. Eastern Time here at Ready, Set, Go. And with that, thanks, and enjoy the rest of your day.